Greetings, fellow classmates. This is Casey Johnson, and this is my PowerPoint presentation on the overview of medical terminology, the lessons learned, and eagerness to become a part of the healthcare profession. Things that I've learned from common errors. Some of the things that I've learned were that documentation is everything. If you can't document if nothing is documented, it doesn't happen. If something is to go wrong, you should at least come to your fellow colleague to find out what's going on so that the patient is not in fault of what's going on with your error, especially in documentation. Also, it's a lot of things as far as documentation that can go wrong even in just your day-to-day activities. So we just have to make sure that those medical errors are not made. For my personal reflection, which was something that I still have to work on before I become a person in the healthcare field, is to not wear my heart on my shoulders. I'm just one of those types of people that I feel like if I can reach you, I will do everything I can, and I know that I'm not going to be able to be attached to a person because, of course, we have people that pass away, and you just have to make sure that you're able to do what you can for that patient at that time. And even if their medical history or their religion is made that you're not able to do certain things, you still have to make sure you do what you can for your patient at that time. From the medical scenario, being that nurse, back again, as I stated before, documentation is very important, and you have to take some time. Of course, I never really thought about it at that time, but getting the proper rest is a good way to make sure that you're doing what you need to do in the medical field, because of course, if you're not getting enough rest, it's very well possible that you can make mistakes. And with those mistakes being made, sometimes once you make that mistake, you can't go back and fix it. So you have to make sure that you're documenting everything correctly, getting your proper rest, and actually your eating habits, of course, too, can make a big difference in the way you work from day to day. With my medical interview with Dr. Gillum, she taught me quite a bit about pharmacy as far as things are always changing. And I believe in the medical field, things are always coming out differently as far as with technology and other things. So it's always best to get those proper trainings in. I just know from in my perspective of working for the pharmaceutical company, we're always doing new trainings because things are always changing in the medical field. New medicines are coming out, new procedures are coming out. So that was great that she showed me that those things are happening in the field. So that's something I have looked forward to learning new things as well as what I'm already learning now. The benefits from learning medical terminology, that you're able to learn parts of the body. It's great to know when something is going wrong with the person's body. You may not always understand it, but it's great to know if someone comes in with a stomach ache, is of course that's something going on with your with the stomach. It's not the same thing with something going on with your foot. It's good to know that you know the difference in those terms, and it's also good to know the difference between just a symptom and a diagnosis. It's good that we have learned the difference in root words, cause words, and the reading comprehension of the words itself. How I plan to do how I plan to use these terms in my upcoming career as a healthcare administrator. I want to open up my own adult daycare. I've seen lots of people over the age of 18 that are in special needs that need that type of help, and a lot of people have healthcare, health care people that help them and work with them, and even members of their family that take care of them, and they all need a break. So I wanted to have that type of place where I can have a doctor on site, nurses on site, and even able to teach the adult daycare, the adult people there at the facility to learn life skills, and also to learn how to take care of themselves if they actually have to. But of course, I would want to know those medical terminologies because, of course, someone can get sick. Someone could have something going on with them psychologically. And I want to be able to explain to their caregiver if something is going on with them. And thank you very much for my presentation. And I'm very thankful for the opportunity to do this. This is my first time doing this. So I thank you very much to my professor and my classmates in the class for helping me along this journey. And I appreciate it so much. Thank you.